Hi, everybody. Thank you for joining us today. My name is Daniel, and I work on the research team at the National Alliance to End Homelessness. We're very excited to welcome you to this webinar. We'll give folks a couple more moments to join, and then we will go ahead and get started. All right. So again, my name is Daniel. I work on the research team at the National Alliance to End Homelessness. Thank you all so much for joining us today to discuss findings and new data from the Annual Homelessness Assessment Report to Congress and Trends in Homelessness. The National Alliance to End Homelessness is a nonpartisan nonprofit organization that is committed to preventing and ending homelessness in the United States. We identify and support policies, programs, and practices that can ensure that everyone has a safe and stable place to live. I'm joined today by three experts who will provide additional context about who experiences homelessness, why people experience homelessness, and what can be done to reduce homelessness going forward. These experts include Brian Moser, who is a VP of Strategy and External Affairs at the Corporation for Supportive Housing, Eric Gartland, a research analyst on the Housing and Income Security team at the Center for Budget and Policy Priorities, and Steve Berg, who is the Chief Policy Officer at the National Alliance to End Homelessness. We strive to create an inclusive space that welcomes diverse voices and opinions. So as always, in any Alliance event, discriminatory or abusive language or behavior that puts people at risk is not tolerated. The chat is not open, but please let us know if you feel unsafe for any reason. A member of our staff will monitor the Q&A and leave time at the end to address as many of your questions as possible. And additionally, this webinar will be recorded, and we will share that recording with you all. So if you want to follow up on anything we say, you will be able to do so. So to dive right in, while we at the Alliance do rely on local organizations and leaders to share information with us about the needs and challenges related to homelessness in their communities, we also spend time analyzing and understanding federal data. And I want to walk through some of those data sources with you so that you understand what I'm referring to in today's presentation. So first, we have the annual point in time count, which is a community-led volunteer effort to count the number of people sleeping in shelters or outside on a single night. Part of the reason we are doing this webinar now is because HUD, the Department of Housing and Urban Development, just recently released the 2025 data in May, about a month ago. The point in time count takes place in January each year and is the largest count of people experiencing homelessness in the United States. To date, it has also been the most authoritative count of the unhoused population in the United States, telling us general trends at the national, state, and local level since 2007. The 2025 data reflects trends in homelessness for the year of 2025 prior to the Trump administration taking office. We also refer to the housing inventory count, which counts the number of shelter beds for people experiencing homelessness and housing beds for people who are formerly unhoused. And finally, we use the US Census Bureau's data, which provides a lot of important context about the primary drivers of homelessness, like housing costs, rental assistance, and the cost of living. These data help us explore why people experience homelessness and whether the root causes of homelessness are improving or getting worse. Now, speaking more directly to the data, in 2025, over 745,000 people experienced homelessness, which marked a slight decrease from 2024, but was significantly higher than any other year during which data was collected. As my colleagues will share, abundant research and data help us to understand why people experience homelessness. And while individual risk factors like illness or unemployment can make it harder to stay housed, we know that the primary reason for homelessness is because incomes and assistance from the federal government outpace the costs of a home. Stepping back, we also see that the number of people who rely on housing and shelter from the homelessness response system is generally increasing each year as more people struggle to afford their rent. Put more simply, workers at community organizations, nonprofits, and government agencies are serving more people in need than ever, over 1 million on a single night in 2025. The majority of these people are served in permanent housing programs. People are often familiar with temporary emergency shelters, but I think it's also useful to explain a little bit more about some of the permanent housing programs that are available for people experiencing homelessness. So these programs are absolutely critical for ending homelessness and include rapid rehousing, which pairs short-term rental assistance for up to 2 years with supportive services like case management and employment services. We also have permanent supportive housing, which some of my colleagues will speak more about later in the presentation, but essentially pairs long-term housing subsidies with more intensive supportive services, specifically for people with disabilities. Data from the Department of Housing and Urban Development indicate that the majority of households in these housing programs still pay rent, albeit at a subsidized rate. And really importantly, once people experiencing homelessness can access these programs, we know that they work well and that they're extraordinarily good at keeping people housed. Federal data indicate that the vast majority in housing programs stay housed or leave these programs to independent permanent housing. In other words, they do not re-enter homelessness. Unfortunately, the data also indicate that these programs are not funded to meet everyone's needs. As a result, we see large numbers of people sleeping outside or in shelters as homelessness has continued to increase. During the 2025 point in time counts, there are enough housing beds for just 9% of people experiencing homelessness. The vast majority of people do not have anywhere to go because there are not enough resources to serve everybody. And while this capacity has increased slightly, especially during the COVID-19 pandemic, when Congress provided a significant increase in funding for these programs, we know that the increases have not been enough. In addition to this information about the capacity of the systems that serve people experiencing homelessness, the Annual Homelessness Assessment Report also gives us information about who experiences homelessness. And since the COVID pandemic, we have seen large increases in the number of people experiencing homelessness across all subpopulations and groups, or most subpopulations and groups, I should say. Policies during the pandemic, as I mentioned, prevented the largest increases in new homelessness, especially amongst people in families, but rising housing costs are impacting everyone, which has led to an 11% increase in family homelessness since 2019. With that said, we know that individuals make up the largest share of people experiencing homelessness, and some of the other presenters will share more about folks experiencing chronic homelessness later in the presentation. Another key trend that we focus on are those folks who are experiencing unsheltered homelessness, or those who are living in a place not meant for human habitation, like a car or in a tent. Every year since 2015, homeless service providers have sheltered more and more people. However, more people also continue to enter homelessness, meaning that the percent of people living unsheltered has remained relatively steady. There are more shelter beds available for some groups, like families, which helps to minimize unsheltered homelessness among this group. Meanwhile, groups that have faced historic discrimination in housing, employment, social services, and social life, like people who are transgender, or gender nonconforming, or Indigenous folks, are more likely to live unsheltered. The last key trend that I'd like to focus on before passing it along to my colleagues is on where people experience homelessness. We see that homelessness exists in every community, from major cities to rural areas. There are people who struggle to afford rent. Unsurprisingly, the majority of people experiencing homelessness are in places where the majority of people live, or cities. But many rural areas have just as high rates of homelessness relative to their smaller population. Large cities are increasingly focused on or have increasingly focused on this issue, and by increasing funding for solutions at the local level, they've been able to make some significant progress, but a lot more work needs to be done. They've increased the number, or a variety of geographies have increased the number of people who are able to access shelter and housing. But as I previously indicated, large numbers of people continue to experience homelessness and are in need of assistance. So these are the trends from 2024 to 2025, which, as I indicated, we've seen reductions in sheltered and unsheltered homelessness in some locations, namely major cities and in some rural areas. But we continue to see increases in sheltered homelessness, in particular in urban suburban areas. So I know that that was a lot of information, and we've already published some written analyses of these data, and we will continue to do so at the National Alliance in the coming weeks and months. So please keep an eye out for that. But fortunately, we also have a wonderful panel that I would like to turn the presentation over to next, because they're going to help us unpack some of these topics in greater detail. So without further ado, I'm going to hand it over to Ryan to talk more about supportive housing and trends in chronic homelessness.
Thanks, Daniel. That was a lovely overview, and appreciate the chance to talk with you all today. My name is Ryan Moser. I am the Vice President for Strategy External Affairs at CSH. I've been at CSH for about 20 years and have worked in multiple jurisdictions across the country in different places, focusing on how to address this issue and others with housing and services. So it's a critical time to be having this conversation. So I'm going to talk a little bit about chronic homelessness, some of the sub-trends on the individual side, and about supportive housing in particular and how we view about it. You can switch to the next slide, Daniel. So thank you. So as Daniel mentioned, there's a decrease in homelessness in 2025, which is great news and news that we've been needing for a while, right? But there's also a modest increase in chronic homelessness, all right? So we're not seeing the same duration shift or the same change in trajectory that we see in the broader homelessness population. There might be a number of different reasons for this. Switch to the next slide, please, Daniel. So when you look at where things are changing state by state, you'll notice that in some places we see that chronic homelessness and homelessness are going down drastically, right? In other places they're going up. And you see some patterns in this, right? So 14 states reported decreases. And then we also see states where we have increases, right? And those states with decreases include places like California, New York, places that have invested heavily in housing and services. And think about that as a primary outlet. It also includes and have large urban concentrations in course, right? But then also includes places like Arkansas, where we see a 49% decrease, and which is a much more rural and just a different demographic location, right? So when I think about these trends, I always try to think like what's underneath, right? And to Daniel's point, this is a point in time. So sometimes numbers can be impacted by weather, how the count is being conducted, shifts that are happening over time. And so when I look at the data, I like to look at it over a 5, 10, 15-year span and thinking about what are the trends that we're seeing and how does it shift over time. Okay, next slide, please. So while we don't know exactly what led to these decreases that we're seeing in certain places, one of the theories is that you are seeing decreases in places that have invested heavily in supportive housing and housing and services in different sort of evidence-based practices that they're using to drive down homelessness and create solutions that address it, right? However, I'll also note that it doesn't matter if you have a large demographic shift happening or a large feed into your system. If you can't create enough exits in your system, you're still going to see an increase in chronic homelessness, right? Even if you're doing the best job possible for the people that are coming in. So we also have to think about how that fits in the bigger scheme of what's going on in your communities and how they function. So the AHAR also indicates, so I'm just going to give a little counterfactual here, right? So Midwest County was saying like, you know what, we see a rise in chronic homelessness, and we're going to attribute that in their case. They say, we think that this is driven in part by a lack of supportive housing, a lack of long-term housing placements. But again, even let's assume you're in this Midwest community and you hit 50, 60 new units that come in and you can create an impact. If you have 100 people hitting your system that are failing out of affordable housing, that are aging into homelessness, that are moving out of a job situation, losing work, and can't make ends meet, you're going to see more people showing up in homelessness. And if you don't have exits for people in any variety of ways, you're going to see that time start to accumulate and you're going to see homelessness, chronic homelessness in particular, drive up. Okay, next slide. So also worth pointing out that that said, although we can see these trends, consistent, serious investment in solutions that we know work makes a huge impact. And I think nothing better indicates this than the consistent pattern of what's happened with veteran homelessness in the United States over, yeah, really going on 15 years now, right? So veterans homelessness has continued to decline. This has been a policy priority that has held constant and been supported by Congress, state and local level leadership to drive veteran homelessness down over a long, sustained period of time. It's included resources that include Veterans Assistant VA supportive housing, VASH, right? It includes resources for employment and support issues and how to help families, right? So supportive services for veterans' families and rapid rehousing, right? And so it's using all of the tools in the bucket in a very concerted way, and it's working with a VA health system that has a particular and specific role that it can play in supporting veterans in the community. So when we think about what's possible, we should be thinking about what we see when we have a national focus, effort, and concerted resources and a push to do what works best, right? So next slide. So one of the things that we know in supportive housing, we know at CSH very deeply, is that communities really struggle with a lack of services and housing, right? So what does that mean? What are the conditions? What do they look like? One of the things that we know is that many people experiencing homelessness also have a need for behavioral health issues and services and supports, and that those are hard to find whether you are homeless or you are not homeless. If you have a family member with mental health issue, with addictive disorder, you can relate to how hard it is to be able um, to find services in the community, to get people into treatment options, to find treatment options that are well set up for them and actually work with their lifestyle so they might be able to continue to work or go to school or whatever they need to do. This is a challenge that we see sort of overall in the health system in the United States, and it's based on how we set up kind of an institutional care model. What I would say is that what that underlies is a really underinvestment in community-based behavioral and health care, and what communities are really struggling with that. So, in fact, most of the adults in the United States, about half of them with mental health, do not receive treatment. And in many communities, there's just a huge drought of professionals, including addiction counselors, psychologists, psychiatrists, all the people that you need to see, long wait lists, and it's hard to find providers, right? So, affordable housing at the same time is in extreme short supply, right? So, we see something like 35 affordable homes for every 100 households that need them. And when you get to the people experiencing homelessness, so this very low income band, right? People at the really making a fixed income or a very, very low income or living on benefits, you're looking at people that are where the numbers are much higher than that. So you're seeing actually a much more specific drought at the lowest income levels. Go ahead to the next slide. So let's do just a minute to spotlight on supportive housing. What is it, right? Right. So supportive housing, I always use this. One of the very first things I learned at CSH was is the but-for rule. So supportive housing is housing which for people whom, but for the housing, they cannot maintain their services in the community, and but for the services, they cannot maintain their housing. So it's this dual need of people with a clinical need, a disability, long and serious support needs that often are durational. They're going to last throughout their life, right? Significant, persistent disabilities and illnesses, right? And at the same time, they're dealing with extreme poverty. So the difference is that when you see a family member, for example, of a person with IDD, but they come from a well-heeled family, they have the ability to support, they may be able to bring supports into their home, they may be able to pay for additional assistance and keep the family stable, right? When you don't have that income base to bring in care that is not well provided or well coordinated, you're going to see destabilization. So that's the kind of the picture of what I think of with supportive housing. We know there's not enough housing and supports out there. And so we see communities working really creatively all over the place to address supportive housing needs. Okay, next slide. And the research shows that supportive housing works and it works really well. So it makes a difference for people, and it doesn't just make a difference for people that are experiencing it, it makes a difference for their communities. It improves public issues that we're all dealing with, and it has long and durational effects for people's lives, right? It changes life patterns. So people stay housed at high rates when they have affordable supportive housing that they need. They reduce their use of unnecessary crisis care like emergency rooms and institutions like jail. So similar to periods of, maybe 20 years ago, the 80s and the 90s, when jails and prisons were being really heavy. We had a big tough on crime push, and there was three strikes laws that came down, and people were saying, we need to really crack down on people. And what we see is that really bloated our jail system. It pushed people into crisis and institutional systems, which then took us 2 decades to work our way through on the back end. So as we see some of the trends that are happening in policy, and this push to think about, well, we don't have enough community resources, how can we push people into mandatory settings or drive them out of public squares, we can expect to see similar results in terms of large deficits for states and localities that have to bear these costs and bad outcomes for people that also just don't have good lasting power. So one of the things we think about at CSH is cross sectors. So there aren't people that are just homeless people, right? Or people that only hit one system, right? There are people with complex needs. So people sometimes have child welfare involvement. Families might have separation issues. They may be dealing with a variety of different disabilities that indicate different public systems. People could have a VA status or veteran status and different issues in trying to access care and different traumas to work through, right? They might be in correctional settings. They might be in residential settings. They might be living in a long-term treatment facility or like a mental health hospital that they don't need to be in, but there is nowhere for them to go, right? So we try to look across the whole picture. And what we see over and over again is that investing in housing with community-based services has this trickle effect on all of these systems by helping to move people out of crisis and into community. Next up. So that said, there are a lot of challenges to scaling supportive housing. And even though it's a good thing to do, and we see what happens at scale when you look at issues like the VA approach that we've had for a number of years, it's hard to move. And there's some challenges in the field itself. So first and foremost, there's not enough funding to create enough supportive housing to meet the need or to preserve it at a high level of quality. So providers are struggling, communities are struggling, and the field is struggling. We also know that compensation is a real problem in the supportive housing industry. We lose great case managers and clinical workers to go work at Home Depot because they can get better benefits and more consistent. It's a lot less stressful and an easier job, right? We also know that it's even worse when we kind of dig into certain areas where there's a lot of competition, right? So to that end, we did a compensation study, which I'll come back to in a minute, nationally, to look at what's the supportive housing compensation field look like across the country. Supportive housing is dealing with a struggling narrative, right? So because these problems that Daniel set up and Eric will walk through at the macro level are pushing more people out of housing into these crisis settings, the question becomes, why isn't the crisis response working? When the real question should be is what's not working that's driving people into crisis? But it's much easier to point a finger at the crisis responder than it is at the overall structural conditions. So we're seeing a really negative narrative saying, we can't afford these long-term solutions. These pieces don't work. I'm being tired of being told that we're working on homelessness and fixing it when all I see around me is continued crisis. So the narrative is challenging, and we're not always our best friends to ourselves in the way that we talk about the work that we're doing. So communities across the country are really struggling to meet this acuity of need that's also happening, right? So because people are stuck longer in homelessness, their acuity is increasing, their trauma is increasing. Additionally, we have a rising acuity of people that are aging in system and community without adequate supports for geriatric needs, aging adult health issues, right? And we have an increased drug supply that is more violent and nasty, not violent, more volatile, nasty, and just challenging from a health perspective. So increased overdoses and issues across the country. So these three things together of this like unpacked trauma, aging coming in, is creating a high acuity, which is being funneled through COCs that are sending people with very high need to programs that may not have adequate services resources to support this increased acuity. So there's a real match and a challenge for people. And that's a lot of what we spend our time thinking about is what does it look like? So last slide for me here, and then I'll pass it to Eric, is to just walk through a couple of the available resources that we have to share with you, and I'll make one last closing comment, right? One, we have the compensation study that I mentioned. So if you look here at these links, you can click through all these links. They'll be available in the slides afterwards, and you look at this new compensation study we've done across the United States of what is it that we've seen as far as what people are able to provide, how are they matching with other resources in the field. So please take a minute to check that out. If you're interested in labor issues, if you're a funder or a financer, if you're worried about your own salary, it can help you kind of position in those places. Second, and the first on this list actually is a study that we did in partnership with NEH to look at what is and is not working in supportive housing. So what are the lessons that providers can tell us about what's happening? And that's looking at a number of different community conversations that we co-hosted and kind of process through to say, like, what are the improvements that could happen in supportive housing and what are the opportunities we can build on? So also a useful read. The third specific resource is the National Research. I'm going out of order, so I'm having trouble with my bullets, right? So the National Research Agenda that CSH just produced. And so that is looking at what are the big unanswered questions that we need to understand better about how to use housing as opposed to whether or not to use housing, but how do we use housing to address these issues? And the last one is that we've just launched in April a new National Center for Housing and Health powered by CSH. And that is you can look that up online and come and join. It includes all of these resources and places to find them, our evaluation work, and just ways to think about how to connect health and housing and work in that space. So I'll pass it to Eric now, which is nice to be able to do because I got to say, Center for Budget Policy Priorities is really good at looking at the macro trends. And so I'm telling you a little bit about what are these micro responses and then reminding us that the micro responses are going to be governed to a large degree on how well we're doing on the macro side. So Eric, happy to pass it to you.
Great. Thanks, Ryan. Yeah, like Daniel mentioned earlier, my name is Eric Gartland. I'm a research analyst at the Center on Budget and Policy Priorities. We're a nonpartisan think tank based in DC. And as Ryan mentioned, my role is to kind of take a step back and look at the broader housing policy landscape and kind of talk through that impact that has on homelessness trends. So you can go to the next slide. So just a high-level overview of what I'll be covering. I'm going to ground us first in those structural housing affordability issues that are driving these current high levels of homelessness, the critical role of rental assistance in helping address those housing affordability issues, outlining some of the current federal policy threats that we're facing, and then end on a more positive note with some state opportunities to kind of help meet this moment in the absence of federal action. Go to the next slide. All right, so this is a chart we like to call the income rent gap analysis that I think really just encapsulates the whole structural issue with housing affordability as it stands today. So you can see in that orange line, we have median rent that has really just risen at a much faster rate than median renter household income. And I think the inevitable result here, right, is when you have housing costs that are rising faster than renters' incomes, there's just this persistent gap between what renters are forced to pay versus what they're actually able to afford. And the result, as I'm sure all of you know, is not only these historic high levels of homelessness, but also these record highs in terms of the number of renters who are cost burden, paying over half their income in rent every month. You can go to the next slide. And so that's the crux of the issue. I think a big I think frustration of mine is when we talk about housing affordability, it's a hot topic right now. And a lot of the discussion, the discourse is around, oh, this is a housing supply issue. If we just build enough housing, then all these issues will go away, including homelessness. And I think we wanted to capture that in this chart, showing that we have had persistently high levels of homelessness, even when we had a housing surplus and while we had, a shortage in units, which is kind of the issue we're dealing with right now in recent years. So housing supply is a huge part of it. And I think we definitely need more affordable housing and we should build housing. But it kind of ignores this reality, that income piece of that income rent gap, where even if we were to build a lot of housing, there are just people who have incredibly low incomes that aren't going to be able to afford market rate housing. And I think that's where rental assistance comes in. We're able to bridge that gap between incomes and rents, and making sure that we're not just talking about supply, but that it's a issue that we need to help close that gap in addition to the supply. Next slide, please. And I think the effectiveness of rental assistance in closing that gap, I think, as Ryan showed a version of this, we've seen the steady decline in veterans experiencing homelessness, and that is not an accident. I think adding on to one of those lines that was in Ryan's chart, we have seen a consistent expansion of that VASH program, this targeted voucher program for homeless veterans. And there's this direct result of, as we expand this program and we are able to house more homeless veterans, it shows that we are capable of solving this issue when we provide adequate resources. Next slide, please. And another example of this, so this is a chart that we update annually that just shows the percent change in homelessness since 2015. And I think another example I was going to lift up, in addition to this VASH program, is you see that shaded area in the middle where we are indicating that there were pandemic relief measures. So things like emergency rental assistance, the emergency housing voucher program, the eviction moratorium. And we put in all these resources, right, to meet this public health crisis, to keep people stably housed. And we see that trend line, right, flattens out a bit for that period where we have all these resources and these relief measures. And then once we see these programs kind of phased out and, either expiring like the moratorium or running out of funds, we see this, huge jump in homelessness in those following years. And so I think that just really indicates again that we know how to solve these issues. I think it involves, putting the appropriate amount of resources towards housing people, and we can see those results play out in those two examples. Next slide, please. So we know how to solve the issue, but the big problem is even if we have these really effective rental assistance programs, only 1 in 4 people who are eligible for rental assistance actually receive it due to a chronic lack of funding. So you can see here, this is consistent across different household types. People who are disabled or an older adult, families with children. Those red bars showing the share of those households who are eligible but aren't able to receive assistance, and those much smaller blue bars showing the share that are assisted. So this creates this widespread unmet need for rental assistance. And the result is, not only all these people that are unable to get the assistance they need, but these really long wait times for people that do eventually receive assistance, and they have to endure these housing affordability issues and try to stay stably housed, even as they're waiting years just to get off the wait list to receive a voucher or get into public housing. And I'll also add, it's not just a rental assistance issue, right? We have widespread unmet need for the services that can effectively pair with rental assistance. So we're just not putting in an adequate amount of resources to these programs that we know are effective at keeping people stably housed. Next slide. So in terms of federal policy threats, all right, Dan, thanks. Federal policy threats, I think they fall into 3 main buckets, things that we're keeping an eye on. The first being a lot of harmful HUD rules and regulations that have been proposed recently, and things that include, the equal access rule, preventing trans people and other gender expansive people from accessing emergency shelters. The mixed status rule is a very blatantly anti-immigrant attempt to take away assistance from households that include a family member who is ineligible because of their citizenship. And then I'll talk a bit more about the work requirements and time limits rule that HUD has recently proposed as well. And so in that second bucket, we also have been facing persistent attempts to slash the budgets for these rental assistance programs that are moving us in the wrong direction of taking more assistance away instead of expanding to meet need. And then the third bucket is outside of just this housing assistance ecosystem. We've seen broader cuts to other safety net programs, including SNAP and Medicaid, which is all interconnected with these other programs that we care about. So you can go to the next slide. So the HUD recently proposed a rule that would allow incredibly stringent time limits and work requirements as low as a 2-year time limit and as harsh as a 40-hour per week work requirement. And we estimate, crunched the numbers and estimated that nearly 3.7 million people currently receiving assistance are at risk of losing that assistance if all of these public housing agencies implemented the most stringent version of these restrictions that HUD is now trying to allow. If you click one more time on the slide, so of those 3.7 million people, we estimated that over half of those would be children that live in these households, and over 2 million are households that are actually working. They just would be potentially over that 2-year time limit or just not working enough hours to meet this 40-hour per week work requirement, maybe due to inconsistent hours or kind of moving in and out of employment because of job market instability. But we just estimate these would be incredibly harmful rules if they are to go into effect. And so something we're definitely keeping an eye on. Next slide, please. So persistent issue we face, and you'll see we come out with a new version of this analysis every time we have a new budget appropriations process. But especially under this current administration, we have seen year after year these attempts to slash the budgets for these programs, these rental assistance programs that we know are effective and crucial in addressing this homelessness crisis. And so you'd see on the left just 2 versions of this analysis we've done. So for fiscal year 2025, we estimated under the House and Senate proposals that hundreds of thousands of people could potentially lose housing vouchers if that budget went into effect. And then on the right, from the fiscal year 2026 House Appropriations bill, over 400,000 people that wouldn't be able to receive assistance if they had gone into effect. We have fortunately so far avoided the most drastic versions of these cuts, but we have still not received adequate funding to even keep pace with inflation and just maintain the current amount of rental assistance, much less expand it to more people that need it. And so we're currently in the middle of the fiscal year 2027 budget appropriations process, and we are once again dealing with proposed cuts to these programs, even at a time where we're at record high level of, housing affordability issues. People can't afford rent, and homelessness remains near historic highs. So something that we are really trying to push back on because we see that this rental assistance and these programs are really crucial for addressing those issues. Next slide, please. So one of the things the Center on Budget and Policy Priorities works on, we don't just do housing policy, but we cover a range of different safety net programs. We have teams that work on SNAP and Medicaid. And so we try to take that more holistic view of what's the interconnection between all these different programs. And as I'm sure a lot of you have seen, the H.R. 1 bill that was passed last fall included these really draconian cuts to Medicaid and SNAP. And we are already seeing the effects play out right now. I know the title says upcoming cuts, but those cuts are now going into effect. And we are seeing just lots of people losing the assistance that helps them pay for their healthcare and keep food on their table. And we wanted to look at, these programs don't exist in isolation, right? They are interconnected. People rely on these different programs to pay for different costs in their life. And you can see here, 3 and 4 households that are receiving rental assistance also receive Medicaid or CHIP with these different related programs for health coverage. And 2 and 3 also get food assistance from the Supplemental Nutrition Assistance Program, or SNAP. And so these cuts are going to impact people that are relying on rental assistance, and just make it even harder. They take these benefits away, make it even harder for them to afford housing, right? Because you don't have that money to pay for groceries or pay for your, medical bill. Next slide, please. So to end on a bit more of a positive note, we have seen some promising progress at the state level. So I know we're facing all these federal policy threats, but we have done some research recently just mapping out where states have implemented their own state-funded rental assistance program. So that's, an attempt to kind of meet that, at least some of that unmet need for rental assistance and help keep more people stably housed. And another thing I'll just quickly mention is not just, implementing these programs, but finding ways to fund them through progressive revenue raisers. So just one example being in Rhode Island, they recently passed a mansion tax. So, a tax implemented on homes over a certain value, and earmarking those funds directly to pay for affordable housing projects and assistance for people experiencing homelessness. So we're seeing some promising, results at the state level. In the absence of federal action and all these threats, I think states being able to step up and fill that gap. So just wanted to end on a more positive note. But yeah, and then last slide, similar to what Ryan was talking through, just a collection of resources. I know they'll be sharing the slides after this webinar. So all these links just take you to recent research that we've put out concerning HUD rules and the funding cuts and those state opportunities that I was just mentioning. And a lot of the charts I used in this presentation were pulled from those reports. So hopefully some helpful resources for people working in this space. But yeah, with that, I'll wrap up and I can pass it back to Daniel.
Thank you so much, Eric and Ryan. We have some great questions coming in the Q&A. Please keep leaving those so we can answer them at the end. But before we do that, I'm pleased to introduce Steve Berg, who's our Chief Policy Officer here at the Alliance. And he's going to talk a little bit about some of the things the Alliance is advocating for and really striving to achieve, and that can address some of the challenges that have been discussed today. So thank you so much, Steve.
All right, thank you, Daniel. Thank you, Ryan and Eric. I'm going to go very quickly through the Alliance's policy agenda for the year, and then we'll have plenty of time for questions. So next slide, please. Most of our policy agenda is about getting decent funding for HUD programs for fiscal 2027. That's the fiscal year that Congress is just starting to work on right now in terms of what funding levels will be. Next slide, please. So first, a quick note on the process Congress uses. If people follow this, the president puts a budget out that calls for a certain amount of spending. Our previous speakers had talked about the shortcomings in that. The lawmakers in Congress release their own budget requests, budget ideas, total amounts, and then each subcommittee on the Appropriations Committee, there's 12 different subcommittees, each of which deals with one or two different federal departments. They come up with their versions of spending bills in the House and also in the Senate, and then at some point, the House and Senate resolve their differences. They pass a final bill, and that gets signed by the president. One or more final bills. And that process usually happens sometime between August and December, and sometimes into the following year. Okay, next slide. The president's budget request, our previous speakers have already said, once again includes big cuts to the homelessness programs, uh, as well as a number of other important housing programs, uh, and would be devastating to all to funding levels for all the work we're doing on homelessness. Next slide, please. The president's budget is, it's important to know that's just a proposal. It doesn't have any force of law. Congress often largely ignores what's in the president's budget request. Last year, Congress completely ignored the president's budget request for homeless programs, which had big cuts in them. And so we're hoping that the Congress will do the same thing this year. Next slide, please. The Alliance tries to take a much more practical approach, a much more bipartisan approach that really looks at the nature of the problem in a very specific way and talks about what kinds of increases in funding will be necessary to really solve the problem. The Alliance on Homeless Assistance, the Alliance's main proposals this year are for a $5.1 billion appropriation, which would be a substantial increase over last year. Most of that would go for the Continuum of Care program. Some of it would go to the ESG program, which is a block grant to state and local governments, mainly to fund shelters and rapid rehousing programs. We are hoping that Congress will use this as what they really see as the starting point for their deliberations. As much as we would like to get this total amount, we understand that there's a lot of other demands on time and energy, but for right now, we're really sticking with this as really what the homeless programs need to get in order to have a substantial increase in the number of people that can be moved out of homelessness and into housing and that can be kept safe in shelters. The ESG program in particular hasn't seen an increase for years and years and years. And we think an increase there would really help communities that don't have sufficient shelter resources to keep people safe while they're working at getting housing. Next slide, please. The other important priority is to protect these programs. The administration, of course, besides its bad budget proposals, has done a number of things to try to change the continuum of care program through the notices of funding opportunity for fiscal 25, and again the one that recently came out for fiscal 26 would shut down a lot of existing programs, disrupt the programs that already exist. So we're proposing that for fiscal 27, there be limits on HUD's ability to make substantial changes in the programs. And these are the proposals here are sort of technical for people who know the continuum of care program. You know that this is about keeping things funded that are already funded and also making new funding available for important new programs that communities need. Next slide, please. Besides the homeless assistance programs, there are other important HUD programs that have a big influence on homelessness. Tenant-based rental assistance is the appropriations account that funds the Housing Choice Voucher Program, sometimes known as the Section 8 program, for those of you who've been doing this for a while. With the Alliance is proposing, again, substantial increases in funding for this program so that it can be a much more useful resource for communities. The Alliance is also looking at the 202 program, which is a program at HUD that funds housing for older adults. Um, Older adults, as people on this call may know, are a rapidly growing share of the homeless population, and the ability of communities to fund more housing for older adults would be greatly enhanced by an increase in the 202 program. Next slide, please. And then outside of the appropriations process, an important priority for us is services for people who are either on the streets or in supportive housing. As Ryan talked about, this is an important piece of the solution to the chronic homelessness problem, and Medicaid is helpful in a couple of different ways. It funds these street medicine programs that help people while they're on the streets, and then it funds supports for supportive housing. Um, the process for funding Medicaid is a whole different process in Congress, not the regular appropriations process, but it's something that we hope people will take a look at and get involved in, and there are you can get information from the Alliance or from corporations from supportive housing or others over the course of the year. Next slide, please. A couple of quick hints about making the case to Congress. Go ahead and to the next slide. Here's a number of just sort of quick tips on how you can make your meetings with members of Congress more effective, members of Congress or their staff. A clear and explicit ask is an important piece. It's important to try to target and ask toward the position that the member of Congress has, what committees they're on. And if you're dealing with a staff person, which at least at the start most people are, what that staff person's authority in the office is. Next slide, please. And then besides those quick tips, there's some general principles about trying to influence Congress, mostly about relationship building. I mean, I try to tell people, make your members of Congress and their staffs partners with you, part of your team working to end homelessness in your community. And these are some of the ways to do that. So let me stop there and turn it back over to Daniel, and we'll have time for questions.
Thank you so much, Steve. That was great, and I think answered one of the questions in the chat, which was about how to get more involved in advocacy. But the Alliance also offers a number of different resources, which you can find on our website if you would like to learn more. We have a little bit of time left for questions. One thing that I am curious to hear from our panelists is if there are any places, communities, or states that you've seen success or heard of interesting things happening to help end homelessness in the United States. Whoever would like to take that, please go ahead.
I mean, I can start.
Yeah, go ahead, Steve.
Okay, I mean, I can start. If you look at the report that I'd recently put out with the point in time counts, where people know what the point in time counts said in their individual communities for 2026, there are a lot of communities where homelessness went down quite a bit, and I think every one of those communities has some things that they did that were helpful on that. We think of like Dallas, Texas, Minneapolis, Minnesota are a couple of places that have interesting things that they've tried out, but there's a lot more than that.
I would build on that just by saying that, and actually those are great examples of jurisdictions where, as opposed to like what's the fascinating new thing that people are trying, which because people are innovative and they're trying new things, it's where are people really pulling all of the cylinders and working together. So like I think the most promising piece is places where like the mayor and the county officials and the high level nonprofit sector and the business community are all saying, you know what, we should work together to figure out how to not be cutting off each other's noses and develop a shared plan. And when you have that kind of local leadership and drive, you're going to see results that come from that. And it actually kind of insulates the community from the vagaries of the noise that happen, and it helps people to keep down if you can show urgency. And I think that's one of the things that our sector needs to remember is that, the average person out there is not waiting for us to tell them, we're working on a housing pipeline. We're going to get back to you in 5 years. They want to know what's happening now. And so how do you make sure that the urgency of the work that the people in our sector feel very personally is actually felt for the community too, and they see the effort, not just the every once in a while kind of piece.
Great, thank you both so much. There was a question in the Q&A about preventing the rising costs of housing. Are there things that can be done to prevent rents from constantly rising, which we know is a challenge for many, many people in our communities right now? Maybe Eric, that's something that you would like to discuss before opening it up to anyone else?
Yeah, no, I appreciate this question because I think, like I said, it's a both and type of deal. So I saw in the question, rental assistance is this limited resource. And I understand, it is in some ways a band-aid to a larger structural issue of costs, rising housing costs that are kind of rising out of control in many places, and incomes just not keeping pace. So I think there's, and that's a whole other presentation on housing supply and boosting housing supply. But we know there are, programs like LIHTC and like I mentioned, like in Rhode Island, these revenue raisers to fund these affordable housing projects. But I just want to reiterate so that there are lots of levers on the housing supply piece of that. But the point I was trying to make is with rental assistance, there's a certain chunk of the population that their incomes are just so low that they won't be able to afford market rate housing, even if we were to boost affordable housing supply. So I think there's always going to be a component of how do we close that gap between incomes and rents for those with, the lowest incomes that are at the highest risk of experiencing homelessness. So hopefully that puts a finer point on what I said.
Great, thanks, Eric. And I was also curious, we've talked a lot about trends in federal data and some of the things that are happening at the policy level at the federal level, but sometimes folks are also interested in learning more about what's happening in their community locally or even at the state level. Do you all have any recommendations for how folks can do that and learn more about the trends in their own community and the ways that they can support efforts to end homelessness locally, either through advocacy or otherwise?
I mean, I'll let Steve and Eric maybe talk about the advocacy side because there's a lot of ways to get involved as an advocate and thinking about how to lean in there. I think that one, go participate in your point in time count. And that's not for a while, right? Right. But at the end of the year, everybody does this point in time count. It's really educational. If you've never done that, and if you've never gone out and experienced like trying to help find people that are homeless and asking them what their experience is, why they're there, that's a great way to kind of get a sense for the field. And there's an open because they need volunteers for these type of pieces. So that's one place that's concrete. I would also say, like, look up who are the providers. You can start at the COC, but supportive housing, for example, is broad, and there are a lot of different providers, COC funded and not COC funded. Look up who's doing this work, engage with them, ask them what kind of policy forums they have. Look for events. This is like a huge election season, so go find out where there might be public events happening where people are talking about housing and homelessness issues. Look for places to engage from that lens. I think there are, in fact, more opportunities to support than there are people that are interested in rolling up their sleeves. So it's really just about connecting to the right people and kind of figuring out how to tie in. So figure out who your local leaders are that you can make inroads with.
Yeah, and be in touch with us. I mean, all our organizations have networks around the country. If you don't know who's working on these issues in your local community, just be in touch with us and we'll point you in the right direction.
Yeah, I'll just add quickly because I think both of these groups do a great job about this with this, but especially with these funding threats, I think one thing we try to do, and I know the Alliance puts out a lot of good research of, I think you could hide behind a dollar amount of a funding cut as an abstraction from the actual human impact of what is happening here. And so we try really hard, especially to, put out reliable analysis, state level data so that you can contact, the people making these decisions and say, look, if you do this thing that you're proposing, thousands of people will, potentially lose their housing and be at risk of eviction and homelessness. So that would just be my recommendation. I think there's lots of great resources out there, and make sure the people making these decisions know that it's real human lives that are being impacted.
Great.
All right,
Thank
Daniel,
you
let me
all.
add one more on because Eric got me going here. So I think, one of the things to remember is that a lot of times things that feel impossible at the state and federal level, are really possible at the local level. So just lean into local ballot initiatives, ways to push, come up with your own ideas, assemble people, think about how local leaders can drive these issues, and think about, like little things, like not little things in reality, like zoning reform pushes, or ways to look at using dispossessed properties that are tax liens. Like there's lots of things that can be done at a local level. So if you are a local advocate and engaging on these pieces, a lot of times there's like two separate conversations. There's one around community development and what's happening from a community side, and then there's a homelessness conversation. So it might just be bridging across those pieces. Sorry, thanks, Dave.
No, that's a great point, and thank you for sharing it. And I know today we only had time to sort of scratch the surface about the data and some of the solutions and things that we're going to be advocating for. But please, as Steve mentioned, stay in touch with each of our organizations, the National Alliance to End Homelessness, the Center for Budget and Policy Priorities, and the Corporation for Supportive Housing to continue to learn more and stay engaged with us. Unfortunately, that is all the time that we have for today, but thank you all for joining us, and please keep an eye out for the recording, which should be coming in the coming days. And thank you again to each of our panelists for taking the time and sharing so much great expertise. Have a great rest of your day, everybody.
Thank you, everybody.